All right, so we are group 3, and we are doing our presentation on the accreditation of healthcare organizations. The members in our group are Riley Bywater, which is me, and then we have Kyle Owens and Claire Stairs. All right, so the first thing talk about is accreditation. What is it? To help me get a better idea of what accreditation was, I just looked it up online, and according to Merriam-Webster, it gives us a few definitions here that I really liked. The first one, to recognize or vouch for as conforming with a standard. Number 2, to recognize an educational institution as maintaining standards that qualify the graduates for admission to higher and more specialized institutions or for professional practice. And 3, to consider or recognize as outstanding. So these are a few of, it's kind of like a broad definition of accreditation, which I think will help us understand as it applies to healthcare. All right, so accreditation of healthcare organizations. Just as the definitions of accreditation taught us, accreditation among healthcare organizations simply means that hospitals will have safe, quality care for their patients. Accreditation is a way for hospitals to make sure they are meeting national quality standards. So it's just kind of putting a bar up there that hospitals are looking to meet so that they can help their patients and just provide for their community. And this next thing here is accreditation mandatory or voluntary. Our presentation or the PowerPoint in this week's lesson really broke this down quite nicely, I thought. So I used some of that information. So accreditation in healthcare is not mandatory, but it will make a healthcare organization look better and more trustworthy. So it is voluntary. And I really like this quote from Darlene Christensen in the PowerPoint. It says, most hospitals seek this accreditation, though it's not required. But by doing so, they're making a statement that they're willing to do more than the minimum sort of governmental expectations for a hospital organization. They're willing to go through that extra step to try to ensure the quality and safety of the services they're providing. So when hospitals are accredited, it just shows that they're trustworthy and that, that we can go to them. Because, if there's a hospital that's accredited and one that's not, of course, we're going to go to the one that is because we want the best care for ourselves. So, it's just ethical, and on the business side, it's also just effective for them. So. And these are just a few of the sources I used.
Accreditation versus board certification. Accreditation is for healthcare organizations. Board certification is for physicians. Next. In the accreditation process, there are 6 steps. The first step is to create a customer central account download standard. Step 2 is to submit the application and deposit money. Annual fees for most small single-service home care providers average $1,500 with on-site survey fees of approximately $3,240. Can you imagine how much it would cost for a hospital? Step number 3 involves signing the accreditation agreement. Step 4 is to submit the per checklist indicating that you are ready for on-site survey. The checklists are developed differently for each specialty and subspecialties. Here's an example of one specialty and one subspecialty. So in chemistry and toxicology, you've got your subdisciplines, the blood gases, chemistry, special chemistry and toxicology, and the description of contents. This is an example of what the inspector does for a specific item during the actual inspection. If you note, this is detailed for bone marrow prepping. Step 5 is to participate in the on-site survey. Step 6 is to receive the accreditation decision, whether yay or nay. If approved, the accreditation lasts 3 years, then has to be renewed. Is accreditation worth it? Since accreditation is a voluntary program, it shows the healthcare organization is going the extra mile. In a study done in 2011, indicates there is consistent evidence that shows that accreditation programs improve the process of care provided by healthcare services. There's considerable evidence to show that accreditation programs improve clinical outcomes of a wide spectrum of clinical conditions. Accreditation programs should be supported as a tool to improve the quality of healthcare services. Board certification is a voluntary process above and beyond the medical licensure. Obtaining a licensure shows a physician has met the minimum competency requirements to diagnose and treat patients. It is not specialty specific. Before a doctor can become board certified, each must complete 4 years of medical education in a college or university, a course of study leading to an MD or DO degree from a qualified medical school, and 3 to 5 years of full-time experience in an accredited residency training program. Each doctor earns initial board certification by passing a written and, in some cases, an oral examination created and administered by the member board in his or her specialty. Some physicians can be certified for life, but most need to be recertified every 6 to 10 years depending on the specialty. Certification is voluntary, so it shows a commitment to their field. Becoming board certified, the physician demonstrates their exceptional expertise in a particular specialty and or subspecialty of medical practice. Medicine is an ongoing, ever-changing science, and certification is there for the physician to keep up on the changes in their specialty. And continued education allows the physician to stay ahead in their field. ISO is the International Organization of Standards. In general, they do not provide certification or assessments, but ensure that products and services are safe, reliable, and of good quality. Countless health professionals rely on ISO management systems to help deliver quality health care with total confidence. Hospitals can become ISO compliant or certified in ISO 9001. It is a quality management system requirement. The ISO 9001 standard is more process-driven and is better for back-end departments such as accounting, human resources, etc. While accreditation is geared more towards standards that directly affect patient care, ISO 9000 2008 strives for consistency of patient care, customer and patient satisfaction, and continual improvement. ISO is not involved in their certification and do not issue certificates. This is performed by external certification bodies, thus a company or organization cannot be certified by ISO. There are many certification companies that will audit organizations and upon success issue ISO 9001 compliance certificates. The last bullet point was interview someone in management at Madison Memorial Hospital and find out why they chose ISO 9000 for their accrediting body. Madison Memorial Hospital is located in Rexburg, and on their website, the introduction is Madison Memorial Hospital is the only county-owned non-critical access hospital in Idaho. Madison Memorial is also a self-sustainable nonprofit hospital, has 96 beds, and is a full-service facility. It is on the forefront of providing evidence-based holistic patient care and linking its community members to the most prominent progressive physicians, treatment, and medical technology available. So I interviewed Nolan Bybee, who's the Director of Risk Management and Compliance. When I asked if he received many phone calls each semester on this question, he said usually, but last semester not one student called. The question about ISO 9000 being Madison Memorial Hospital's accrediting body is inaccurate, he said. The ISO standard was created in 1943 really to help drive quality and improvement processes originally in the manufacturing. In 2001, Madison Memorial Hospital was the 13th hospital in the nation certified ISO standard. And it's important to Madison Memorial because it helps improve their processes and improve customer satisfaction and their customer service scores. Mr. Bybee said that there's 4 accrediting bodies. We're real familiar with the Joint Commission. There's also the American Osteopathic Association, Centers for Improvement in Healthcare Quality, and Det Norske Veritas. From the Joint Commission's webpage, it says they seek to continuously improve healthcare for the public, evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. The Joint Commission accredits and certifies more than 21,000 healthcare organizations and programs in the United States, including hospitals, and healthcare organizations that provide ambulatory and office-based surgery, behavioral health, home health care, laboratory, and nursing care center services. The Joint Commission is the nation's oldest and largest standard-setting accrediting body in healthcare. The second one, the American Osteopathic Association, or AOA, received Centers for Medicare and Medicaid Services deemed status in 1965, and they work mostly in the southern states. The AOA accredits a number of different institutions and programs, as well as approves osteopathic postdoctoral training programs. The third one, the Center for Improvement in Healthcare Quality, or CIHQ, is the new kid on the block. They received the Center for Medicare and Medicaid Services deemed status in 2013. On their webpage, it says hospitals that want to participate in the Medicare program must be in compliance with the conditions of participation by the Centers for Medicare and Medicaid Services. CMS accepts accreditation by CIHQ to deem acute care hospitals to be in compliance with the COP. As a deemed status provider, CIHQ provides hospitals with the tools and support they need to successfully achieve accreditation. And the fourth one, Det Norske Veritas, received CMS deemed status in 2008. And in 2009, Madison Memorial Hospital received their certificate of accreditation. DNV-GL's pioneering NIHO, which stands for National Integrated Accreditation for Healthcare, program integrates ISO 9001 with the Medicare conditions of participation. DNV received CMS deeming authority in 2008 and has since accredited nearly 500 hospitals of all sizes and in every region of the United States. They are the first and only accreditation program to integrate the CMS conditions of participation with the ISO 9000 quality management program. Their collaborative survey teams visit the hospitals annually, not every 3 years, making each visit far less stressful and more of a routine checkup for the hospital's success, not an epic investigation of the hospital's faults. And DNV's National Integrated Accreditation for Healthcare, this engages management, top management, all the way down to the frontline staff. And this provides a structure for the staff to focus on common goals such as patient care and safety. When everybody participates, I think that everyone takes ownership in those goals, and it helps make for a better work environment. Mr. Bybee said that not every hospital has to be accredited. However, most are becoming accredited due to payers, such as Blue Cross, Blue Shield, Aetna, and others. They're pushing hospitals to become accredited. If the hospitals do not become accredited, this may hurt during contract renewal for reimbursements. He said it's good to have an audit. In this report to CMS, Madison Memorial Hospital sees where they are doing good, where they need to improve, and the areas that they really need to improve. There's a great value in having choices and options for an accrediting body. Madison Memorial likes that DMV uses a team approach to accreditation. And like we said in Vitigo, DMV is the only one of the four that will complete the accreditation survey and the ISO standards at the same time. When I asked Mr. Bybee about the DNV accreditation and if it affected Madison Memorial Hospital recruiting top talent on either the medical side or the management side of business, he said that's no problem whatsoever. And when asked when he shops for property and casualty or workers' comp insurance, do these companies ever mention that their premiums will be lower with the Joint Commission accreditation? And he said this is also a non-issue. In years past, he would have to write on the applications that DNV was their accrediting body, but in the last 2 or 3 years, the forms now list all the 4 options that he mentioned earlier. On Madison Memorial's webpage, it says they have grown substantially over the years, but it has never lost the enduring goals of fulfilling the emotional, physical, and spiritual needs of those we serve. The organization has earned the ISO 9000-2000 or deemed status. This is the most sought-after recognition for quality outcome management by international healthcare organizations. Under ISO certification, recently DNV complimented Madison Memorial for exceptional performance improvement, claiming that we were the only one of the hospitals that had taken almost every measure for improvement. We have been accredited by DNV since July 2009. The most recent recertification took place on July 30th, 2015. And their webpage also has their certificate of accreditation. People are interested in that. Also in the web page, they have the link for hospital care, and it has information about the quality of care at over 4,000 Medicare certified hospitals across the country. Madison Memorial Hospital is also monitored by its compliance to CMS to CMS best practices or core measures. And these measures are specific to a diagnosis, and they list 10 areas. In the second quarter of 2013, with heart failure, pneumonia, and chest pain, Madison Memorial was 100% compliant with CMS best practices. They are 99% compliant with surgery measure. And for emergency department, Madison Memorial is significantly lower than the national average. In timing, they are almost twice as responsive to their patients than the national average. In speaking with Mr. Bybee, you could tell that he had great pride in the facility where he worked. And he said he's very passionate about healthcare administration, and he's always happy to help the next generation of healthcare administrators. And he looks forward to working with some of us in the future. So it was a great interview. And in the sources where I snagged Mr. Bybee's picture, there's a YouTube link, and it talks about the angel babies that don't live, they die, they're stillborn or they're miscarried, and up to 20 weeks. Madison Memorial Hospital has its Angel Babies program, and they will bury these sweet little infants in a special cemetery up in Idaho. So they have a lot of outreach programs to be a part of the community and to be a positive force in the community. So it was a great interview. Thank you.